Sanibona boGeli, welcome back to my YouTube channel. If you're new, hi, my name is Fusi. If you're a returning subscriber, hi baby, thank you so much for coming back. Thank you for the love and the support. Please don't forget to like, comment and subscribe and share with your friends. So today I'll just be doing my makeup while I'll tell you guys about my experience, my first vlog. So I only started my clinical years this year, so I'm in the 4th year in med school. And so I just finished my first block, the first 6 weeks, and it was general surgery. So I'll just like give you guys a brief and just tell you how I feel about everything, you know, how everything was for me. Okay, it's just gonna be the whole thing. I'll give you guys a run through. I will just let you guys in, especially for people who actually want to pursue medicine, or people who are in medicine who just kind of just want to relate. So yeah, but yeah, so that's what this video is about today. So it's your favorite mid-school baddie. That's me. So that's my brand. So yeah, so let me actually get started with the makeup while I talk to you guys. Yeah, let's get into it. Okay, so my lashes are already on and my brows are kind of done already. So I hope this angle is good. Yes, this angle is good. And I'll move closer to the mirror as I work so you guys will see everything up close. You can also see my legs. I haven't put any foundation on yet. So yeah, don't think I'm slipping. I'm not slipping. My lace is always going to be melted. It's just that I haven't put foundation on because I know about this video. So yeah, so I'll start off with, excuse me, oops, my Fit Me's. I still haven't switched. I still haven't switched yet. I know I said I would, but I have not switched yet. But I will. It's just that I don't really wear makeup that much anymore. I'm not really a fan of makeup. Like, okay, I'm lying. No, I'm lying. It's just that makeup makes, like, I don't like how it feels on my skin. And it makes my skin break out. And I think the main reason why I like started wearing makeup less was because I wanted to embrace my natural skin more. So that's the main thing, Yakon, actually. Not just bullshit, I was just mentioning. The main reason why I started makeup was because I wanted to learn to love my natural skin. And to just, you know, I'm a person who's just has acne. Like, it's just who I am. And I know that I can go to a dermatologist for it. It's just that guys, like, yeah, I'm feeling like consistency. Guys, that's just where I fall off, consistency. But I think also this block has been very like demanding for me, and so I've honestly had other priorities. I didn't really prioritize my skin, if I'm being honest. I finished my pills. I didn't really go back for anything, like. And now my pills, I was taking them inconsistently, and when I finished them, I was supposed to go back for follow-up, and I didn't do that. So yeah, anyway, sorry for ranting about my skin. I hope you guys can see clearly. I hope you guys can see me clearly. The lighting is tripping a bit because guys, so now I'm starting with my brows. Okay, so let's start talking about med school. So Begise general surgery, ne? This block for 6 weeks. So a block is 6 weeks. I'm gonna start ONG on Monday, which is today's Saturday. So Monday, Saturday, Sunday, then Monday. So this coming week, you're ONG. And you guys, everyone says ONG is very demanding and it's very hectic. So I'm really expecting that, honestly. Like, I'm expecting that it's not gonna be all fun and games. Anyway, sorry again. So a general surgery topics are just, how do I put it? Topics in when I general surgery. Just like surgical cases that mainly require surgical interventions. So yeah, so you've got different firms or different, how can I put it in like a non-medical way? You've got different departments or different subgroups or whatever, but general surgery is like it's the umbrella. Under general surgery, there are different like departments within that department that deal with different things. So there's peds, so dealing with babies that need surgery, you know. So it's just anything about where I'm a patient I think like cleans. That's not really specific in the sense that, you know, like ONG, for example, OBS&G, where you'd be dealing with, sorry, it's more specific. The surgery is, but it's specific. A general surgery, it's not really that specific. It's quite broad. I'd say it's fairly broad. So yeah, so it's a very, okay, did I enjoy it? I only really started like enjoying it at the end, but I think I was just tired of school, bruh. Like, I was just tired. And I think in the Shayla was that, you know, your brain, you know. So because of that, I was a bit, yeah, well. But otherwise, if I'm being honest, I said just said Jimland. Like, you said Jimland. Sorry. It said Jimlandic. It's very interesting. It's very logical. It's straightforward. Like, it's just that Usha is cut. You only have 6 weeks ago. And within those 6 weeks, there's also a lot of work that you have to do, especially rounds, all these classes and all these expectations they have of you. Like, they expect you to know everything. Yeah, well, and it's not fair. Like they literally expect you to know everything. They expect you to know everything that they know. Okay, not everything that they know, but like a lot of stuff within like 2 weeks, you know, of being there. So yeah, but if you just study, bruh, research, you just need some time. You just need to adjust and adapt really quickly, because they do things in their own way. Adjust really quickly, then it's right. Like, I even like I said, it's just straightforward, it's logical. It's just that it just needs you to adapt really quickly. That was my thing. I'm not so that was the thing. Okay, that was my issue, research. But otherwise, like, it's fairly straightforward. It's fairly straightforward and it's logical. What else can I tell you guys? Research. Oops. So within a surgery, sorry, like I've got a face and a half. Well, if you baking, don't know. Let me get something. You guys, I was saying that I have a face and a half. So grateful to God. I just want to take this moment to thank my mom and my dad for giving me, oh, and God, all three of them, for giving me this face that I have that is so beautiful. Okay, sorry guys, but I am really grateful. Okay, also aside, I'm very grateful for my face. Like, I know sometimes I don't see it, you know, like, you know, so, but anyways, off topic. Sorry. So okay, yeah. What else can I tell you guys about this stage? I feel like I should have planned this properly. It was just like a last minute decision though, to get a live it and just let you guys know. Okay, so you obviously, oh yeah, you have a logbook. So a logbook is basically a book that has a list of, it has stuff that you have to get done. So it's like a checklist. Yeah, so the number of surgeries that you have to attend and the types of surgeries. Excuse me, in J. What's in Funny Foundation, man? In J. So things that you just have to do. Yeah, that you just have to get done before the block ends. And you just get signatures from the doctor you were with, or the doctor who is leading the surgery. You know, it's that type of thing, if that's making sense. Like, it's like, you know, it's just like a list. It's not a list, but it's like got stuff and it's got space for a signature. I don't have my thingy handy in. Yeah. And then also, I think I should do a breakdown for ONG as well, so I can actually show you guys. Blog book ONG is mad. So yeah. So yeah, okay. We have the total checklist, and when is to make sure that that stuff, most of the stuff is complete, and you get signatures. Yeah, you also have to present a morning meeting. Okay? I don't know. Okay, a morning meeting is basically a meeting, self-explanatory. A meeting that's in the morning. A meeting at 6 a.m. where it's the doctors of the department, so the consultants, the regs, the MOs and stuff like that, where they like discuss cases and stuff like that. Yeah, but then as students you have to present, but also they also present, like the MOs and the MO go present. I don't think I've seen an MO presenting, but they should be. But the MOs, everyone presents except the consultants. Then you get marked for it, so you have to present, and then after presenting you have to go get, like, choose a consultant who's gonna sign that you presented and give you a mark. So you have to have at least 5 of those, a minimum of 5. Yeah, which is like, it's not easy because you only have 6 weeks. So my cases, or I present that my cases that, or like I'm a wardin. So you know when you do a ward rounds, there's ward rounds are basically when you're just checking on patients. So you can clerk those patients and then present it in the morning meeting, or you clerk patients, or you choose to present patients who you clerked when you were on call. So clerking is, I don't know how to pronounce it. I know that it's spelled clerk as clerking. I don't know if people pronounce it differently, clerking or clerking, but okay, whatever. That's when you just get information from patient diakone to kind of get a direction or get clues and indications what the patient in. So that's basically what you do, and then you go present, and you go, okay, you present. You don't present and go back to rest and sleep. Sorry, it's an inside joke with my group, so to speak. So yeah, so uyayicleka i-patient yakho. Musiyicleka i-patient yakho, uye endlini uyobuka ama-symptoms e-patient, ucabanga ukuthi i-patient yakho inani, read up on it. Or actually, I'm getting the order wrong. Ucleka i-patient yakho, ne? Uhlale lapho ucabanga ukuthi i-patient yakho inani, ingaba nani. Muthanda, you can cheat and look at the patient's file, because it has notes in it with the patient, what the patient probably has. But sometimes the notes are wrong, let me tell you. Anyways, because the doctors are also human beings, they also make mistakes now, but sometimes they don't know, or they're convinced that the patient in a local, the patient in so yeah. Musukwenzile lokho, yeah, then you yocanga ukuthi i-patient inani, musucheckile, udiscuss nama-group members akho. You prepare a presentation, you can discuss with your MOs. With the MOs, with the regs, any of the doctors who are willing to help, you can discuss with them, you can ask them for help, you practice presenting to them. But you have to present to at least, I think it was at least 2 or 3 people, different doctors, so they can give you their opinions and they can give you questions that they could possibly ask you. Good morning meeting, because they ask you questions about your topic, they ask you questions on everything that you said, and they ask you a lot about the condition that your patient has or your diagnosis for your patient. So you really have to be able to answer those questions, because if you don't, I think but when you didn't read, you just went back to rest and you slept, you didn't read. So last thing you want is to be a laughing stock. So you better apply pressure and go get it done. That was the stressful thing, I said. You really, you have to be able to prepare for questions that they could possibly ask you, and you must be able to answer most of them. And also, you're still not sure with regards to how to structure your stuff. Even if you structure, do I look structuration? You really only by week 6, okay, last couple of weeks, do you really know how to structure and stick to structure? And then it after how long? After 4 weeks, 3 or 4 weeks, they don't allow you to use your book. So you're allowed to take a book with you, but after a certain point, they're no more books allowed. Where did I put this? They're no more books allowed. So you have to know everything, all the patient's information, the condition. You need to know everything off by heart. So if they ask you questions, you have to have an answer. You have to know from presenting complaints. Presenting complaints is with the patient I would put in the patient if you present an special, patient special. So that's what it is. So you need to know that up until your diagnosis, your investigations, your treatments, your plan for this patient, how would you treat this patient. You need to know all of that, and then you also need to know that particular condition, and also any other condition that the patient could possibly have that's similar to yours. So that presents similarly, but is not the cause of what your patient has. So that's called a differential diagnosis. So yeah, you have to do that, all of that as well. So okay, what else do you want to say? Good team. Yeah, okay, so that's what presenting is like. It's very nerve-wracking. I know it's nerve-wracking, and it has an anxiety, a lot of anxiety. But the more you present, the better you get at it, if I'm being honest. So I would advise anyone to present as much as they can, so you can get better at it. Different departments do things differently. Some departments, I heard, they don't really present as much as you do, Kasej. So okay, yeah, you have to present at least minimum of 5 presentations in a space of 6 weeks. It sounds like it's enough time. I thought it was enough time. I thought I was like gonna do like 7 presentations. It isn't enough time because you have to study other things, because you have to have learning issues, word rounds that you need to go back and read on topics, then come back like Sasa was my answer for everything, you know. It's just a lot. And then you have to start studying for your exams. It's overwhelming, but it's nice. I enjoyed it. When I think about it, I was just under pressure and I was just tired. I got to a point where I was just tired. Like saying from like I was like, yeah, not saying from the but saying from somewhere else, you know. But yeah, okay. Yeah, so you attend your surgeries, the different types of surgeries. So I didn't attend too many surgeries, if I'm being honest. It's not a good thing. I didn't attend a lot of surgeries. I attended, I feel to be scattered. When I'm looking at the message, I'm being catelled, Milanche, you, bruh. Ulala late, Vuga early, yo, I, bright morning, I don't know, past 7. It's just overwhelming. Musafi, and it's very overwhelming. But otherwise, in night. So surgeries, I attended in the one I took a video of. What is it? Cholecystectomy, laparoscopic cholecystectomy. That's the surgery that I attended, or that I observed. We were supposed to observe another one. Okay, so I mentioned that they are like your sub departments within the surge department as a whole. So you rotate in each of them for the 6 weeks. So by the time you leave, you see total experience of all of them. So okay, so and in those departments they usually have surgical days, or theater days, sorry. Surgical theater days, where they go to theater. So it's usually 2 times a week or once a week. I think it's 2 times a week. So yeah, 2 times a week near a theater. If Nitoli chance, if something else doesn't come up, because in between, remember, you have lectures. You're still a student and you still need to attend. You still need to attend lectures. Lectures don't, lectures that are actually going to be assessed in your exams. So you need to do all of that, the hospital stuff, as well as attending lectures that they're going to ask you during exams. So yeah, that's just how it goes. So yeah, if you do get a chance, you can observe as much as you can. It's just very draining, and because you're like, yo, class, go to kulambi. So okay, yeah. What else did I want to say? So yeah, I only observed, I think I was supposed to observe more, but we did not. My group did not, because there were some times where we couldn't because of the classes that I'm saying. So okay, it's the one that I took a video of, the cholecystectomy. What other surgery? We were supposed to observe another one. I remember the patient in a surgical hernia, but we ended up not observing it because we had to go. I think we were just tired. We just really wanted to go. Wasn't it like Valentine's Day? It was Valentine's Day. I remember I was not having a good day at all. At all. I hated Valentine's Day this year, as per usual. I've never had a good Valentine's Day. Sorry. So okay, yeah, we were supposed to observe hernia that day, but we didn't. Instead of attending confession. So yeah, that's how it works. Yeah, so also you have your imaging, ne? So okay, a patient mikula, you suspect with inpatient in a CFST. So a patient you have to investigate them. Yes, you send tatamagazi or tumele lab and everything, but you also have to do imaging. So for imaging, it depends what condition is suspected with the patient. So that's what guides the imaging. So in conditions like ulcer, peptic ulcer diseases, you know, or like upper GI bleeds or lower GI bleeds. So a patient is basically coughing blood, or there's blood in the patient's stools. So you have to do endoscopes. So you also get a chance to go see those. I think I included in my previous one briefly. I'm not sure if I did. I don't think I did. But yeah, we do that as well. Yeah. What else do you do in Jekasej? What am I leaving out? So usually the day starts at 7:30. It finishes, lunch is at 1, so you can finish before or after 1. I usually finish after 1, usually before or at 1. Then you usually have a class after lunch. It's really lento, guys. You can see I've even seen highlights and color. It's me, and I'm sorry I didn't see. It's me. So I was saying, where was I going? I was saying, oh, by the time it finishes. Oh, I was telling you guys about endoscopes. Yeah, so okay, when I do my endoscope, yeah, those, you also get signatures for those. So yeah, you just get as many signatures as you can. That's really it. That's really just it. My makeup is done. But honestly, all in all, I enjoyed Surge. Do I think I'm going to specialize in it? It's too soon to tell. But I did enjoy Surge. Like, I won't lie, I did enjoy it. I don't like doing eyeliner yet, but I'll put on mascara. And a lot of people say Surge is nice. Surge is really nice. Like, it's nice. You go to me, it's like usaqala unyaka bha ingqondo isaphithise ingqondo isaphithise sazama ukurecall information ebasic ngokuphuma emaholidini. Oh my gosh, you also have a workbook, Kasej. A workbook that has almost 100 pages that you have to fill within the 6 weeks. Like, you know, and nobody told me or told us that we should start it as soon as we get there. Like, you should start it as soon as you get there. Like, as soon as you get Kasej. Day 1, ubuqala workbook, because everything piles up such that you don't get time for the workbook. Nje ile nto ehluphayo iworkbook yahlupha eshihanga So next vlog is ONG Monday. I'll see what I can film for you guys. You know me on patient confidentiality. I will. It's not confidentiality. One of the ethical don't. I don't like showing patients in vulnerable situations. So I'll never show you guys a patient or show you guys details. I'll see what I'll do. And I know it's very demanding, so I'll try. And guys, I'll see what I can do, honestly. To take you along my med school journey. Guys, like I always judged medical doctors. Like, okay, I don't know if it's just where I'm studying, yeah? But every crazy story that you hear, it's always about medical doctors. And I've always been such a judgmental person. I'm like, these people are who's part. It's always about, you know, until I lived it, you guys, like as soon as utola ituwa bra, veluguti opitizele, like I feel the urge. I don't do it, but I feel the urge now. Like you can understand that, like if you see a med student or medical doctor, those people need a hug. Those people need a hug. They're not good people, but they need a hug. They need a hug. They go through a lot. So if you see them, but pitizela, like understand, you know, because it's the entire time. So as soon as you get a chance to breathe, you just want to go wild and do as much as you can, because you know it's really. So yeah, I get now why the wildest people are usually like people who have really demanding occupations or in very demanding fields. You know, you really, when you go outside, you want to make the most of it. It's understandable. I get it. I get it. I usually have it out relating that I think valid justice. So guys, ngiyabakhulumela yabona mhlanje ama students no dokotela ngiyabakhulumela ngicela nje Nkosi yami nibaxelele labantu banenkinga eziningi abantu bahlezi behlukumezile nje bahlezi bene pressure bacinene labantu. Let them be, let them go wild. They need it. Like they need it. So okay, yeah, but I really, all in all, I really enjoyed the surgery. Let me do my lip gloss. I really enjoyed the surgery. Yeah, I did. Shame. At first I hated it. I loved it, like, and I'm gonna miss the people a lot. Very funny people. Very funny people. But and yeah, they make it enjoyable. Well, they make it kind of enjoyable. More than enjoyable. They make it enjoyable. Well, for me, I'm trying to speak overall, okay? But all of this is my opinion and my experience. So I enjoyed it. Shame. It was, they were, yeah, nice. So, okay. Yeah, guys, let me just finish up my makeup and I'll be back to show you guys. Okay, while I lay my nails. No, I wish I was going somewhere. What a beautiful, what a babe. What a beautiful woman. What a beautiful being. What a beautiful creature I am. Anyways, let's move on. So, exams. So exams, you have, what is it? It's an OSCE, MEQ, and IPA. So we had the OSCE and MEQ on the same day. Then the IPA was the following day. So what an OSCE is, it's just, there's 10 stations in total, 4 written stations, and 6 practical stations or clinical stations. Where 4, there's questions you answer. They time you, they give you 5 minutes for each station. They time you, after 5 minutes you have to move on to the next one and go into the next one. Yeah, you get the whole drift. So yo, oh no. Okay, so asking, so yeah, so okay, yeah, you get clinical, you get written as well. So for clinical, you get, they'll be like, this patient has this condition, examine for this condition. You do that, they ask you questions, you answer, 5 minutes. This patient has this, examine for this, blah blah. That's what it is. That's all it is. It is very nerve-wracking. Like, yeah, panicky such that you call information when I think about it, because if you don't laugh, you'll cry. Dogwood. Sorry, Dad. So that was about 2 hours long in total, because song is rotated. So in total, there's 23 of us in the group. So they had 23 stations. So I told you that there's 10 stations at 7 Zion. Then there's 13 resting stations. So there's no one outside who's gonna tell you answers or whatever. We're all inside and all. Then you have MEQ. MEQ is a written paper. Just a normal paper. It was 4 hours long, 150 marks. A lot of writing, a lot of thinking, a lot of guessing. A lot of guessing. But it was a fair paper. It was straightforward. So was the OSCE. It's just that I'm a nerves actually with OSCE. Then you have your IPA the following day. IPA, you get there, they take you to a patient. They don't tell you what your patient has. You just you inspect, you examine the patient, you speak to the patient, and they tell you what they have, or not tell you what they have, but they'll describe their symptoms and stuff like that. You have to go sit and be like, okay, this patient, this patient has this condition. Yeah, so you'd be like, this patient has this condition. Then they give you 15 minutes to clerk, to interact with the patient, to examine the patient and everything. That's 15 minutes in total. Then you go, they give you another 15 minutes to go sit somewhere and prepare. So yeah, to prepare everything, the full thing. So how the patient presents. So you have to know what the patient has. You have to give them your diagnosis. You give them history. So history is basically any information that's clinically relevant to that patient or to the case. So an example is social history. Social history, your social life, né? What you do in social life, you smoke and you drink. So in the medical field, that's important. It's especially important in specific conditions. So you have to mention it in specific conditions. So you ask, it's an example of social history, family history, any history of malignancy, cancer. So if the patient has a cancer, you ask about that specifically, about that type of thing. So you do all of that. You examine your patient. You say what investigations you would do if in a collab. So AR means a patient had a peripheral arterial disease. So I didn't have access to a Doppler ultrasound. That's what you use. The imaging, I didn't have access to imaging. It's going to take up too much time and stuff like that. So I didn't do it, but I said I would do this, and this is what I expect, blah blah, why I would do this, etc, etc. So okay, you prepare all of that for 15 minutes. You prepare it. Treatment for a patient. Keep in mind, you don't have any books, you don't have any phones with you. It's all coming from here. So yeah, then you go to your examiner, you present your case, they ask you questions about your case, and you give answers about your case. So they ask you, why didn't you put this? They give you, I will tell you, you left things out, blah blah. So you do that, and then you give yourself a mark at the end. They're like, what would you give yourself? Then they give you a mark, but they don't give you what mark. They don't tell you what mark they give you. But you only find out that at the end of the year, when you finish the entire year. So when I'm finished 4th year, I'll know what I got for this blog. So okay, yeah, those are the exams. Passage. They are fair exams. They're not really too difficult. But one of my patients who had like crazy, like complex diseases, you know. Mine is pretty straightforward, thank goodness. So some people but the patient in a thyroid disease, but like I think I'm saying it's complex because so I'm just very glad that I didn't get that. Now soft tissue tumors we didn't really do. Actually, we did a day before, 2 days before exams. So that's a rundown. Message. It's brief. I hope you guys enjoyed it. And I enjoyed talking about it. Yeah, I don't know if my lace is done. I want to take some pictures. Can you guys see my lace? Love, this is not a rhetorical question, Kabang. Like I'm asking you guys. Can you see it? If you can, tell me, olive hands. If you can, tell me, olive hands. Sorry, guys. So yeah, this is my look. I'm gonna take some pictures and post them on Instagram now. Some videos. How cute is my top? Can you guys see it? Yeah. Anyway, so thank you so much for watching this video. Thank you for watching up until this point. Please don't forget to like, comment, and subscribe, and share with your friends. Yeah, please subscribe. Please keep watching for more med school content and everything like that, and more of the med school baddie. Bye guys, thank you so much.